Hello and welcome to another video in Foundations in Maternal and Newborn Health. In today's video, we're going to go over routes of entry or routes of administration. And so this is essentially how is drug getting into the body. And so, of course, we have a few different ways to get drugs into people. The first is injections. And so, of course, this comprises actually a lot of different subcategories. We'll only go over a few today, but there are many different places that you can inject drugs into someone. So the first will be intravenous. Intravenous. So of course, intra means in and venous means vein. So this is into a patient's veins. We also have intramuscular. And again, intra means in, muscular means the muscle. So this would be into the muscle. And then we also have subcutaneous. And sub means under, and cutaneous is one of the bottom layers of the skin. So this is under the skin. So there are many more types of injections. You can inject, into the bone. You can inject into the eye. There are many different routes of entry of injections, but these are kind of the three that we'll touch on today. We also have inhalation. So of course this would be through the lungs, and you can think of things like a puffer if you have asthma or someone has asthma, or you can also even think of things like smoking. So you get nicotine through your lungs through inhalation. Of course, we'll also have the oral route or ingestion. And so, of course, you're thinking kind of pills here, anything that you kind of consume, you kind of eat or swallow would be oral or ingestion. And then lastly, we have topical. And I've kind of grouped these all together, but of course there are many different ways that you could have a topical drug. So you could put kind of a skin patch on, so you can think of like a nicotine patch, so right onto the skin. Then you can also have kind of a rectal suppository, or even a vaginal suppository. So these are kind of the four general classes of drug administration or routes of entry. And what's important to note is that each of these have pros and cons to the different routes. And so depending on the drug of choice, oftentimes you can get the drug into someone through multiple different means, but you pick based on kind of the needs, based on how fast you need the drug to act. So the speed of onset, or the speed at which the drug is absorbed and has its effect, and then also location. So when we talk about intravenous injections, the onset of the drug is very, very fast. So 30 to 60 seconds maybe. So very, very quick. Intramuscular would be kind of over 10 minutes. And then subcutaneous would be even slower. We're talking over 15 to 30 minutes roughly. So these different routes of injections even have different onsets of speed. Inhalation kind of sits between these at around 2 to 3 minutes. Again, it depends on your drug and how much you take and whatnot. Oral route or ingestion is quite slow. We're looking at 30 to 90 minutes for onset here. So very, very slow route comparatively. Topical, again, varies widely. If you have a skin patch, this can range anywhere from minutes to hours, again, depending on the drug. And rectal suppositories, we're looking at about 5 to 30 minutes, again, depending on a lot of different factors. So that's the speed at which these different routes of entry affect how the drug is, how quickly the drug acts. And then, of course, we also have location, which is important. So there are a few examples here. A puffer for your lungs would be a good example. So another example, maybe more applicable, would be dinoprostone. So this is a drug that helps with cervical ripening. So it's helpful when you're inducing labor. Induce labor. And of course, you want this as close to the cervix as possible. So vaginal suppository here just makes sense. So depending on the speed at which you need your drug to act and where the drug needs to act, you pick a different route of entry.